as you all know, we do our monthly training topics. In the month of February, we're discussing transcultural nursing, and today's topic is Hispanic and Latino American culture. Here in Jacksonville, we have a population of a little over 864,000 people. The Hispanic Latino culture is a little over 65,000. That breaks down to about 13.2% of the Jacksonville population being Hispanic Latino Americans. Over these next few slides, we'll discuss communication, social roles, personal space, time orientation, and religion. In communicating with this culture, maintaining respect is highly important. If you know Spanish, speak it. If you don't know Spanish, always offer to provide translation services. In this culture, within most households, the man is the head of the family and making decisions overall. The women are more protected because the celerity of the family depends on her. Family members always look to elders for advice, and the eldest male holds the greatest power. To maintain respect of these cultures, be sure to acknowledge the male in the room. Look at him, talk to him, introduce yourself to him, as well as talking to the patient themselves. This will maintain that respect. That'll make them feel like they're being involved in the medical decisions. The culture feels more comfortable when they're physically close to each other and communicate in a warm interpersonal way. When you communicate with them, try to use personal gestures. Put a hand on the shoulder, shake their hand. It'll give them that warm and fuzzy feeling that they're looking for. It may be considered rude if you address the family or the patient by their first name. They have the hyphenated surnames, so whenever you address them, use that, and after you establish a relationship with them, ask them which way they prefer it. The major religion of Hispanic Latino origin is Catholic, and there is an increasing number of Pentecostal. Prayer and religious symbols such as amulets, candle lighting, visiting shrines are accepted practices for illness prevention. The Hispanic Latino culture is more present time oriented, so there's more emphasis on what's occurring right now, not what they are going to do tomorrow. As a result, they may show up late for appointments, they may not show up for appointments, so try to make it a practice to place appointment reminder calls. Now let's discuss health issue concerns in the Hispanic Latino culture. Being present time oriented, this culture tends to neglect preventative care. In the Catholic religion, the only accepted birth control is rhythm. Recommendations for weight loss may not be acknowledged because plumpness is considered ideal and thinness is seen as a problem. Therefore, they have a high-calorie diet, more sedentary lifestyles, and genetics contributing to health risks. Because they rely on elders for advice, social work is not accustomed. For social, physical, and physiological concerns, they may seek a religious, holistic healer. This lack of exercise, high-calorie diet, and genetics lead to high rates of hypertension and diabetes mellitus, which are closely linked with obesity. Of Hispanic Latino Americans aging over 20, 43% of them are obese.
Wow.
The Hispanic Latino diet consists of beans, grains, tomatoes, minimal vegetables, fruits, whole milk versus low-fat or skim milk, beef versus processed meats, and they prefer eggs and legumes versus fats and oils and sugars and candies. So there's a couple of pros, a couple of cons. Now let's look at concerns and interventions for healthcare providers. That's what we're here for. We've discussed that this culture is present time oriented, prefers religion and elders versus social workers, prefers plumpness versus thinness, and maintains a higher calorie diet. With this information, you still want to give the patients and family interventions that will promote best health. However, to provide interventions that reflect the Hispanic Latino culture, it's a little rough. So you should always just make sure that you include the family, include the male in the interventions. And that's the best way you can just keep that respectful relationship continuing. So some options to do so with these specific health risks are incorporate patient and family teaching on self-health management, incorporate patient and family teaching on imbalanced nutrition, assess for barriers that may interfere with client-family follow-up, treatment recommendations, refer overweight patient and family to dietitian for weight loss counseling. So you see in all of those, I include patient and family. Here we have our Healthy People 2020 objectives for Hispanic, Latino Americans culture. They are to reduce the disease and economic burden, diabetes, mellitus, and improve the quality of life for people who are at risk or have the disease. Improve cardiovascular health, prevention and detection, early identification and treatment for heart attack and stroke, as well as treatment for the risk factors. And the third one here is promote health and reduce risk of disease by healthy diets and achieving and maintaining healthy body weight. What suggestions do you all have to implement Healthy People 2020 objectives here in our facility and throughout Jacksonville?
Well, my name is Trista Castro from the Cath Lab, and I was just thinking, since, this culture seems to like soccer, why don't we have like group meeting where they can play soccer and meet other, Hispanic or Latino people that have a handle on their healthy eating habits and diet, and they can just discuss what they've done differently in the way they cook their food or anything.
Well, like soccer teams, actually.
Yeah.
That's a good one.
That's a good one. Well, I propose, I'm Vanessa Freeman, and I'm from the diabetes unit, and I propose healthy food fairs in the community where we can also, in these fairs, we can check blood pressures and cholesterol and teach glucose monitoring and just encourage the preventive care for diabetes.
Okay.
And I'm Michelle from the orthopedic trauma unit, and as far as significant improvements in the body mass index, I believe that we can hold Healthy for Life in services, and here in the hospital for the Hispanic community, so that they can have direct education from us experienced staff. And then I kind of thought of a how often to weigh those pounds kind of activity, just to give them encouragement and to help them be more compliant with their health.
Okay, those are great ideas. If you guys could just email those to Donna, we might be able to get those things going.
Okay.
All right. CLASS stands for Culturally and Linguistically Appropriate Services. Section 2719 of CLASS requires accommodation for a threshold percentage literate in the same non-English language. The ACS data supplies a chart for U.S. counties at or exceed a 10% threshold for a variety of non-English language. In Duval County, Florida, they're not on the chart, which means that they're below the threshold for Hispanic, Latino American class standards. Again, I'd like to thank you all for coming today, and I'll email you this training so that you can disperse it amongst your departments and start providing training here in our facility to see what we can do to improve it.
All right.